Now, in this tutorial, we are going to visualize management. For the management, you're still going to use the SchrDbb algorithm, where you're going to start with the disease. So how do you manage a neuropathy? Is it clear? Generally, you have to know that nerves have irreversible damage. When there is already a damage on the nerve, you cannot do any other irreversible action on the nerve damage. Is it clear? A nerve damage is, you need to know that what among the cell cycle and cell division, we said that cell division is divided into two main parts in cell cycle. So in the cell cycle, you have two main parts. The smallest part is going to be the cell division time. Is it clear? And the cell division time is going to be the period of called mitosis. Is it clear? Now the longest time now is the interphase. This is the longest time, the interphase in cell cycle. Now you need to know that what this interphase is divided into the G1 phase, divided into the S phase, and then it's divided into the G2 phase. Is it clear? So most of the cells of the body, the epithelial cells, the connective tissue cells, the bony cells, the hepatic cells are capable of having the interphase, and they are also having the cell division phase. But the nerve cells, is it clear? And also some muscle cells, not all, some muscle cells, particularly the skeletal muscles. Is it clear? So these cells are not capable again of dividing because they have penetrated the G0 phase. In the G0 phase, when you've entered the G0 phase, you cannot get out into the cell division phase again of mitosis when you're in the G0 phase. So these cells cannot divide again. That's why every time there's an injury to the nerve, it's very difficult to have a cell division for by that nerve to produce again another nerve. So when you have injury, it's irreversible. So coming back to the SchrDbb algorithm, I just wanted to say that what in neuropathic, when you have already an injury to the nerve, in neuropathic damage, it is irreversible. What you have to do on the management to prevent further damage to the nerve. And to prevent further damage to the nerve now is by controlling mostly the cause. Is it clear? You need to control the cause of the neuropathy. Now, for the cause of the neuropathy, we have multiple ones. Poliomyelitis. You have to treat poliomyelitis. There is no you have to know that there is no treatment of poliomyelitis. The only thing, we can only use immunoglobulins, but that is not particularly very the immunoglobulins are not particularly very shown to have treated poliomyelitis. Poliomyelitis has a very poor outcome. When you're infected immediately, it's highly sure that you're going to die from a respiratory failure, the absence of the muscular contraction when it affects their cervical spine. Now, for the herpes zoster, for the treatment, we use acyclovir. Is it clear? We use acyclovir. So it is acyclovir is an it is used against virus. It's an antiviral medication. For the Lyme disease, we use antiparasitic medications like sulfadoxine, sulfamethoxazole trimethoprim. Is it clear? Sulfamethoxazole, trimethoprim. That's Cotrim or Bactrim. You can use it. Is it clear? So it's going to treat Borrelia burgdorferi. For autoimmune disease like Guillain-Barré syndrome, for Guillain-Barré syndrome, you need to know that what to treat Guillain-Barré syndrome, you can use now immunoglobulins. Is it clear? So you use immunoglobulins that is going to bind against the bad immunoglobulins that all the bad antibodies. Use immunoglobulins that bind against those antibodies in order to neutralize it. Is it clear? So you can the first management that you can start is just by reducing the proliferation, because you need to know that every time you have autoimmune antibodies, you have to reduce the action of the white blood cells. So you can do by immune suppression. A way of immune suppression, you use betamethasone. Is it clear? And then the best management is by using immunoglobulins. The next one is diabetes. You have to do a diabetic control, to do a sugar control of the patient. And your target is that what the glycated hemoglobin should be less than 7%. That's your target, your first target. And then your random blood sugar should be less than 140 milligram per deciliter. Is it clear? So those are your target hemoglobin. Is it clear? Target hemoglobin should be glycated hemoglobin less than 7%, and the random blood sugar should be less than 140 milligram per deciliter. Is it clear? Now the next one is central. When you have amyotrophic lateral sclerosis is a diagnosis that is already for life. There is no treatment for amyotrophic lateral sclerosis, only palliative till the patient die. Unfortunately. Now the next thing that you have to do again after evaluating the cause to prevent the further damage, again you have to know that what other elements that can help you also in the diagnosis of a neuropathy, particularly if it is a trauma. If it's an acute neuropathy, we can treat by doing a grafting. Basically meaning that when you take a nerve from a location that is less important to a location that is more important. Is it clear? So you can take a nerve grafting, is it clear, which can be used in neuropathies. So neuropathies you can do grafting, particularly if it is an acute neuropathy. Is it clear? And now the complication. You need to know that what in neuropathies there are different outcomes, and the outcomes are based on the histopathologic outcomes. Is it clear? There are different outcomes. The first one is neuropaxia. When you have an injury to the nerve, the first thing that can occur is neuropaxia. And neuropaxia is just a loss of function of the nerve without any damage of the nerve of the axons. Is it clear? Loss of function of the nerve without any damage of the axons. Is it clear? That's neuropaxia. So a patient may not feel, he may not do action with that nerve, but it's not because of the damage of the nerve, but it's only a loss of function. To treat the neuropaxia, the only thing you require is by using anti-inflammatory, because the nerve is swollen, it is not functioning well. Is it clear? So there may be a trauma that has occurred there, or there may be a sudden injury via antibodies and other things. Is it clear? So those nerves, the best thing to treat when you have a neuropaxia is just by using anti-inflammatory drugs, particularly steroids like betamethasone, or you can use prednisolone. Is it clear? Prednisolone is the best that is used now in our context. Now, the next thing after neuropaxia, we have also neurotmexis. You see, the second one is axonomesis or axonomesis. Axonomesis is that where you have certain axons are going to be injured, is it clear? But there are presence of certain other axons. So here, the patient may still move because of certain axons. Is it clear? But here is not complete. Now you have a complete nerve damage when you have a neurotmexis. Is it clear? Neurotmexis. Here you have a complete nerve bulk injury. Is it clear? In neurotmexis. And in neurotmexis, you have to know that when you have an acute neurotmexis, the treatment is surgery where you can do a grafting. Is it clear? And then you do end-to-end anastomosis. Is it clear? So you culture a graft and then you do an end-to-end anastomosis for neurotmexis. Particularly if you have the nerves of the hand which are affected, you can culture a nerve from a muscle at the level of the medial aspect of the leg. Is it clear? And then you place it on the hand. Is it clear? So those are different nerves that you can collect and then place it and replace to do a nerve repair, primary nerve repair or secondary nerve repair. So those are the different things that are being done there. Now, still for the complication, the major complication that we have to visualize here is arterial ulcer. Is a venous ulcer. You have to treat now the ulcer. You treat the ulcer now by which method? By using debridement, as I've just explained in wound healing, and you also do wound dressing. Is it clear? So there is a tutorial on this that you have to get very well in order to understand it. Is it clear? So after visualizing now the management, you have also I've forgotten to say that you have to also treat the treatment. You have to treat also the causes. The treatment of the causes, I've forgotten to tell that in case of spondylitis, you may have also a prostate cancer that you have to treat the prostate cancer. A breast cancer, you treat the breast cancer. The thyroid, a lymphoma, a renal cancer, all of them you have to treat them in order to get rid, in order to prevent a secondary infection again or resulting to a neuropathy. So those are the different things that you have to do. And then the last one is the prognosis of a neuropathy. Generally, a neuropathy does not have a good prognosis because it is an irreversible damage. Is it clear? So those are the elements you have to note.